بسم الله الرحمن الرحيم. السلام عليكم. رح نبلش محاضرات ستريبتوكوكساي. هدول باقي محاضرتين. I might just put them together in one file just for ease of access بدل ما نكون في 1 و 2 فيكونوا مع بعض محاضرة واحدة. So let's start. Streptococcus is the other gram-positive coccus, the first being staph, obviously. Streptococci of medical importance هذا بنحكيهم التيبل الجاية. and بهاي المحاضرة راح نبلش نحكي عن all streptococci other than strep pneumonia, and then we will cover strep pneumonia at the end. هلا بعكس staphylococcus, streptococci especially هدول هم اللي لهم أهمية طبية of those for medical importance are many. يعني staff كان عندنا 3 ستافات هذول كنا نحكي عنهم. Streptococci and especially the virulence group are many species, and so we instead of إنه نسميهم كل واحدة ونحفظهم كل واحدة, we usually use a classification system to describe them rather than individually name them. فشو أهمية Streptococci? What gives Streptococci this importance? Let's see some properties. زي ما حكينا, they are the invaders. Staphylococci were the nesters, so they grow in chains along their axis. زي ما انتم شايفين, they keep growing along the same axis and not haphazardly like Staphylococci. So they grow in chains, sometimes in pairs بنشوفهم, and especially in pneumococcus. And all streptococci حكينا أول شيء نعمله عشان نعرف إن هاي staph ولا strep, بعمل catalase. If it is positive, then it is staph. If it's negative, then it is a strep. طبعا obviously after I see that it is a gram-positive coccus. But catalase negative, I'm going towards talking about streptococci. So they are all catalase negative. So this large number of streptococci حكينا فيهم grouping systems. The first grouping system is called the Lancefield grouping, and Lancefield is a person. So this grouping is done by serology. So obviously based on antibody-antigen reaction. So based on the presence of what antigen do we look for? Is the polysaccharide, obviously, and the teichoic acid antigens of streptococci. So حسب هدول الانتيبوديز we نستخدم serology. Nowadays we have this streamlined in that it is done on latex. يجي مثلا كرتونة عليها latex ولزق عليها الانتيجنز in specific wells. بتحط البكتيريا, عفوا نلزق عليها antibody, بتحط البكتيريا, you put the antigen, and then you see which one clumps, and that gives you the group right away. So only those that are catalase negative and coagulase negative are grouped طبعا. فإحنا عندنا group A, B, and D هم هذولا that are human pathogens. فعندنا 3 Lancefield groups A, B, and D. هذولا هم that are human pathogens. الطريقة الأخرى by the presence or their ability to break down blood. So streptococci are naturally grown on blood agar. So if they completely lyse blood, they are called beta hemolytics. So now we have groups A, B, and D, and then beta hemolytic, alpha hemolytic, or gamma hemolytic. And beta حكينا, it completely lyses RBCs. Alpha partially digests RBC, بطلع عندك هذا اللون الأخضر is the breakdown product of hemoglobin, and it's not completely broken down, so it is green زي ما هو موجود بالكول بلادر مثلا. And then gamma hemolysis does not break the red blood cells that are in the agar at all. So that's the second identification system for streptococci, what type of hemolysis is present. So alpha hemolytic زي ما حكينا, they form a green zone. This is the incomplete lysis of red blood cells. زي ما حكينا, the green color is when hydrogen peroxide produced by the bacteria oxidizes hemoglobin زي ما حكينا to biliverdin. Nothing that we didn't mention. Beta hemolytics form a clear zone, completely lyse red blood cells, production of hemolysins, and this is the ones that do beta hemolysis. They have hemolysin, which is the enzyme that completely break down RBCs. So the production of enzymes, this is called streptolysin O hemolysins, نسميهم streptolysin O and streptolysin S راح نحكي كمان قدام عنهم in the pathogenesis section. Okay, some streptococci are non-hemolytics and have no enzymes to break down red blood cells. فهذا الليتكس اللي وجدتكم اياه بكون هيك زي كرتونه وعليها هدول الويلز وعليها الانتي. So you put the bacteria from the swab or whatever you take from the patient and you بتلفلفها هيك على if it clumps then there's an antibody antigen reaction. This is obviously a Lancefield group B. So this is a group B streptococcus. طبعا ما بتعمل hemolysis الا لما تعملها growth on agar. So the antibodies are bound on latex زي ما حكينا and if they react زي ما هون موجودين then you have a positive test. فهلا أول and this is يعني one of the main tables بهاي المحاضرة. So now we are grouping streptococci according to the two grouping systems together. So the hemolysis and the Lancefield grouping. فخلينا نقسمهم مع بعض. The beta hemolytics, the ones that completely lyse, هدول بنحطهم بجروب لحالهم هيهم بيتا هيموليتكس جروب لحالهم the alpha hemolytics group لحالهم and the none or unknown إذا مش ما في شيء or A or none or alpha or B or none, so the ones that are anything else are actually group D. So the first thing that we do grouping and then we look at the hemolysis. طلع معنا group A, B and B beta hemolytic. ما في شيء grouping system لا A ولا B ولا D. We will talk about this because it's not applicable. This is an alpha hemolysis pattern. So the beta hemolytics هلا زي ما متذكروا حكينا بالستافيلوكوكساي we did we had the boss شو كانت staph aureus هي الباص. It has the antibiotic resistance. It had almost all the pathogenesis factor and the virus factors. And it did the most of the disease. كان عندنا staph epidermidis اللي هي متخصصة بالبايوفيلم formation والforeign objects. كان عندنا staph saprophyticus المتخصصة بالurinary tract. هلا هنا we don't have a clear boss, but we have a specialty بكل واحدة. في عندنا واحدة specialize in everything. زي ما حكينا كنا نفرق بين الstaph saprophyticus والstaph epidermidis. وجدنا مثلا انه نستخدم antibiotic مثلا نوفوبايسين and we see that epidermidis is sensitive to it. So that's the same thing here that we have in gram-positive cocci. So إذا طلع عندي I grow it was a beta hemolytic, I would do a grouping بطلع معي يا group A يا group B. So if I want to differentiate between high ولا high, how do I see? So strep pyogenes, the dominant one of the two beta hemolytics, the dominant one يعني إيش the dominant one يعني the one that causes most disease. He group A beta hemolytic streptococci is actually sensitive. So the more serious of the two causes has sensitivity to bacitracin. So that's how we differentiate between the two. So we have grouping system and then we have bacitracin sensitivity as well. So strep agalactia, we'll talk about it. This is a group B beta hemolytic streptococcus and it is less disease causing and it have more يعني a smaller spectrum of disease. بنروح على الالفا hemolytics مع بعض. We will see. I don't have any Lancefield grouping. I have Streptococcus pneumonia, a very serious or can be a serious disease causing. تعمل pneumonia وتعمل meningitis. تعمل كثير upper respiratory tract infections. عندي virulence group which is هم are streptococci into several species. طلع strep sanguinus mutans وميتس وجوردوني وساليفاريس وانجيونس وكثير انواع. So it's a group and it's actually the typical hemolysis. كمان هذا يعني شوي بيحكوا عنه ممكن في different hemolysis ويعني but it's grouped here with the alpha hemolytics. So with the alpha hemolytics, this is a very dense group and septic pneumonia. ما عندنا Landsfield grouping, so we do the dominant one in disease-causing Streptococcus pneumonia is inhibited by the antibiotic of choice that we choose, which is Optocin. Optocin is inhibitory, or strep pneumonia is sensitive to it, as well as it is bile soluble, so it is also sensitive to bile as well. So the dominant one of the two is sensitive. Viridans group is not bile soluble. تذكروا إنه viridans group موجودة بالmouth, so it makes more sense that it is not bile soluble and is resistant to Optocin. هلا شو ضل عنا؟ ضل عنا الجروب دي. In group D, we don't really depend on hemolysis because sometimes it can be anything. في عنا Enterococcus fecalis و Streptococcus pubis. Of the two, E. fecalis is the boss. شو يعني؟ It causes more disease. It can cause more disease. Both of them are in the gut. هاي هي الإشي من يعني الغريب عنا. Is to have a gram positive in the gut. كيف gram positive عايشة بالgut? So it has to be able to resist bile, so it can live with the gram negatives inside the gut. So E. fecalis and Streptococcus pubis, so both can live in the gut. The more dominant one, E. fecalis, that can cause endocarditis. Streptococcus pubis can also cause endocarditis, but E. fecalis can grow in higher salt concentration, and it is resistant to penicillins. It is the boss of these two. The boss of antibiotic resistance in all Streptococci is Enterococcus. Because why? Because it lives in the فكروا فيها بهذه الطريقة إنه it lives in the gut. كل هالجرام negatives اللي عندهم هالمليون resistance to all these antibiotics, بتعرضوا لأنواع كثير من antibiotics in the food. They become resistant to these antibiotics, and that's how we also have E. fecalis. So obviously it will be resistant to penicillins, and the other Streptococcus pubis is sensitive to penicillins. So now I can throw at you any Streptococcus, and then you'll be able to go through this algorithm. هذه beta hemolytic, basic trace and sensitivity. It's a group A. حكينا this is a dominant and disease causing. Streptococcus is seriousness. E. fecalis antibiotic resistance, and so on. So diseases شو بيساووا؟ Diseases Streptococci cause a wide variety of infections. تمام. Group A اللي هي beta hemolytic. Group A Streptococcus pyogenes is حكينا هاي the leading cause of pharyngitis and cellulitis, which is soft tissue infection. It is an important cause of impetigo زي وجدت بشرطة بالستاف أوريوس, as well as necrotizing fasciitis رح نحكي عنها كمان بالفصل القادم. Streptococcal toxic shock syndrome, so the disease causing قاعدين نحكي disease causing. So and then even though حكينا Kawasaki is not really proven to be an immunologic reaction to staph, we have a proven immunological reaction, two actually, not one, that are caused by Streptococci and Streptococcus viridans. Streptococcus pyogenes. Rheumatic fever, which is also affects the heart, and acute glomerulonephritis. فشو طلعنا من هاي السلايد؟ طلعنا منها إنه the three pathogenesis mechanisms of bacteria are present in the leading disease-causing bacteria Streptococcus pyogenes. So it has direct action, pharyngitis, cellulitis, impetigo. It has toxigenic action by producing exotoxins, and it has immunologic reaction as well, and عنده rheumatic fever and glomerulonephritis. So the dominant disease-causing bacteria of the Streptococci is Strep pyogenes that can cause disease in all three pathogenesis mechanisms: toxic producing, direct invasion, and immunologic reaction. الأجلاكتيا هاي neonatal sepsis and meningitis. جروب بي راح تسمعوا جروب بي كثير أكثر إشي بالجايني. اللي حد بداوم جاي لما داوموا جايني بتشوفوا gynecology and especially obstetrics, والأمهات لما يولدوا they might have Streptococcus agalactiae, and then the baby, as the baby passes through the canal, might have sepsis and meningitis from group B. Group B colonization is a very important indication of why we should treat women before they deliver, so we can reduce neonatal sepsis and meningitis. حكينا Enterococcus faecalis is an important cause of hospital acquired urinary tract infection كتير مهمة, and endocarditis, هي أول endocarditis. Verdens group is the most common cause of subacute endocarditis. حكينا الأولى كانت acute endocarditis اللي هي in normal valves كانت بالستاف. Subacute in the Verdens group when you manipulate the mouth for dentists. So if you manipulate the mouth, the dominant cause, the most common cause of endocarditis, هاي حكينا, don't put your strap, no, don't put the strip into the mouth strip from the patient's Verdens group into the heart. That's the second one. And Streptococcus pubis, especially in people with so the third one is Streptococcus pubis, which causes also endocarditis, but this has a special case. كتير بيحبوها بالlicense exams USMLE. So someone with endocarditis طلعت معاه Streptococcus pubis, بدك تشوف, you have to investigate the patient for colorectal cancer, because usually patients with colorectal cancer can have invasion by Streptococcus pubis, usually an opportunistic organism that only in this setting will invade the blood and cause endocarditis. فمن هاي نطلع عليها انه الانتيروكوكس والستريبتوكوكس كان جروب دي كلهم direct invasion. Verdens group والأجلاكتيا both are also direct invasion. ما في كلهم, they only have the same one mechanism of the three mechanisms of pathogenesis of bacteria. Cellulitis, هاي شكلها, not if you don't treat it, there's erythema and swelling مثلا. This is group A, it is the most common cause. Pharyngitis also group A. So important antigens of the beta hemolytic streptococci, especially of group A, إنه عندهم the C carbohydrates. The C carbohydrate in the cell wall, it determines the group of beta hemolytic streptococci, and this is what we use something that to determine the grouping. This is what is done for the grouping for beta hemolytics. C carbohydrate is in the cell wall, and that's the first one. M protein is the most important virulence factor and determines the type of the group A beta hemolytic streptococci. It protrudes from the outer surface of the cell, interferes with the ingestion of phagocytes, so it is an antiphagocytic factor. So this is an important factor. So C and M. Antibodies to M protein only gives you immunity to that specific Streptococcus group A. So that means there's an 80 different serotypes of M protein. حكينا antigenic gene switching that bacteria have. So there's 80 different genes for the M protein. So that means you can virtually get infected by group A Streptococci 80 times, because there are 80 different serotypes in the M protein. So you have to be able to produce a naturally new antibody for each of these to have immunity. So strains of Streptococcus pyogenes that produce this certain homologue of M protein. هاي النقطة كتير مهمة. The immunologic reaction of Streptococci is actually the antibodies that are produced against the M protein. كيف يعني? So we have 80 serotypes of M protein. كل واحد له بنعمل له antibody مختلف. تمام. هلا we found that certain M proteins, the antibody that you produce against that one actually reacts to the heart, and we call these rheumatogenic strains. Means if you get infected by this, and they usually cause pharyngitis. If you get infected by this and then you produce antibodies to clear it, these antibodies will react to the heart and cause rheumatic fever and destruction of the heart valves. So that is a very important thing. And the dominant valve in this case will be the mitral valve. Whereas there are other strains, the other واحد كمان أنواع تانية مش كله 80. يعني خلينا نحكي مثلا 3-4 منهم are rheumatogenic. If that patient happens to be infected by one of them and you do not give them antibiotics and they have to clear them by themselves and have a high antibody titer, this high antibodies will attack the heart, and this is he has been attacked by a rheumatogenic group A beta hemolytic streptococci. Now other strains من هالثمانية خلينا نحكي 3-4 ثانيات are nephrogenic. In the same manner, those if produce antibodies and you do not clear it quickly, مثلا ما أعطيته antibiotic, these strains and these antibodies will attack the kidney and cause acute glomerulonephritis in these children. So we have rheumatogenic strains and we have nephrogenic strains, and the majority are non-rheumatogenic or nephrogenic. So although the M protein is the main antiphagocytic component of group A's streptococci, it prevents complement activation as well, and the organism has a polysaccharide capsule as well, which is it has a negative charge and hinders phagocytosis. So the classification of streptococci, so we have beta hemolytic streptococci. These are the ones that are arranged in groups A to U, homolandspeed groups, and based on the C protein. So this is determined by a precipitin test with a specific antisera or مثلا immunofluorescence or whatever. Group A are one of the most important human pathogens. These are the most common bacteria cause of pharyngitis and a very common cause of skin infections. They like to adhere to pharyngeal epithelium via repeatoic acid and the M protein. Many strains have capsule which makes them antiphagocytic and they are sensitive to basitracin. هذا البوس اللي بخوف is actually sensitive to basitracin when we are trying to know which beta hemolytic that we have. فهاي مثلا we have two beta hemolytics here. حطينا basitracin disc and then it has formed a clear zone. It killed the bacteria. So this obviously will be the group A beta hemolytic streptococci, and this is probably group B. Group B, Streptococcus agalacti, has a different disease profile. It can colonize the genital tract of some women and can cause neonatal sepsis and meningitis when the baby passes through. Staph saprophyticus is the other one. They are usually basitracin resistant and they hydrolyze hip rate, which is an important diagnostic criterion. عادة نستخدم هذا to quickly diagnose it. So هلا نروح على group D. حكينا group D, these are the classical enteric gram-positive cocci. We have very few gram-positives in the gut. The dominant ones are the group D اللي هم enterococcus and the non-enterococcus اللي هم strep pubis. Enterococci are members of the colon normal flora. they are normal there. It's not abnormal to have them. But حكينا enterococcus بالhospital, patient بالhospital قاعد تعمل له catheterization بالبلادر, تعمل له surgeries, تعمل له whatever. So you are manipulating this patient inside the hospital, and this is why it's a dominant cause of hospital-acquired urinary tract infection, maybe even endocarditis, and the same for strep pubis. So both of them are normal colon flora. They are very hardy organisms. هذه هي, because they are living in this harsh environment in the colon, they are very hardy and they can grow in very harsh conditions, especially in the presence of bile. Enterococcus can live in even hypertonic saline, and they are the dominant ones in antibiotic resistance. They are not killed by penicillin G. This is why we utilize this synergistic combination of penicillin and aminoglycoside to kill enterococci. We combine the both. عادة this is a very important combination. aminoglycoside gentamicin مثلا مع beta lactam to kill enterococci. حكينا بتذكروا لما كنا نحكي عن البانكومايسين, we know that there are vancomycin resistant enterococci. زي ما عندنا MRSA صار عندنا versa, and now we have in the same manner for enterococci. The vancomycin resistance is actually present in enterococci, and this is why we have vancomycin resistant enterococci, which are a very important cause and much feared cause of life-threatening nosocomial. هاي المهمة هاي nosocomial. So these are hospital-acquired infections. أغلب strains of E. faecium are vancomycin resistant than the strains of E. faecalis. This sometimes comes up on board exams, but rarely. Non-enterococcal group D اللي هي strep pubis حكيناها. It's not resistant to penicillin. It is not inhibited by. It is inhibited by 6.5% NaCl, so it's less hardy than its counterpart Enterococcus. And we mentioned it is very important in colon cancer. هلا non beta hemolytic streptococci. Some streptococci produce no hemolysis, هدول gamma hemolytics, and others produce alpha hemolysis. So the two major هلا نحكي عن alpha hemolysis هم حكينا Streptococcus pneumonia, the one that is sensitive to optogen, and then the viridans group which is resistant to optogen, and حكينا the viridans group include all the ones that you see in the ones that can cause مثلا dental caries, the one that cause all these dental infections. Pneumococci and viridans streptococci are distinguished حكينا by main criteria هم optogen راح يكونوا pneumococci are sensitive to it, and the bile solubility obviously كمان pneumococci are soluble in bile. Mouth flora, viridans group is a normal mouth flora. So this is one way to remember why they are not, if you expose them to bile, they might be more resistant to bile. Streptococcus intermedius and anginosus are usually alpha hemolytic or non-hemolytic, so they are found primarily in the mouth and the colon as well. The viridans group, those are the streptococci that remain once we exclude beta hemolytis. معنا beta hemolytic صار عندنا alpha hemolytic, and we exclude the Streptococcus pneumonia. هذا الجروب اللي بضل. So if you exclude everything else, that's the main group that stays, and it's actually the largest group. It contains many members. So the first exclusion criteria is beta hemolysis. So they are all usually alpha hemolytics, and so they form this green color in the blood agar. And viridans actually means green in Latin. So by the end of your training وتخلصوا السنوات البيسك you'll know a lot of Latin, مثلا viridans, sanguinis, aureus حكينا. All these are colors. So the other exclusion criteria between the two alpha hemolytics, pneumococcus and viridans group, is actually the sensitivity to optogen حكيناها. And then several species that are usually commensals. They are present there normally, and then opportunistic in a compromised patient, especially if they are immune compromised, or if you introduce a lot of them into the blood by مثلا dental manipulation. So they are the main cause of dental caries, as mentioned before, زي ما حكينا, and they are the major cause of endocarditis in these operations. Since it is a major group, the identification and taxonomy is still under controversy. حكيناها. Okay. Major differences between them and Streptococcus pneumonia is their ability to resist optogen and then being bile insoluble. Enterococci are usually selected by growth of and biosculin. Biofilm formation, Streptococcus mutans synthesize polysaccharides dextrans that are found in the dental plaque and lead to dental caries. As they eat, they release acids, and these acids actually what destroys enamel. They have the other problem is that they form biofilms. تذكروا محاضرة الجروث حكينا إنه biofilm formers have a different growth curve than others because they're not trying to grow as fast as possible. They are trying to lay down this matrix and live inside it and actually lay dormant and then grow slowly over time. حكينا إنه to prevent them from causing the biofilm, I have to mechanically remove them daily, which is what is called إنه هو toothbrushing. So إذا أنت كنت أنت مثلا cardiologist, you want to tell people to always have great dental hygiene because you want to prevent these from invasion. وحكينا كمان لو قدام كمان because they are facultative anaerobes, they improve the situation, they improve the environment for anaerobes to grow, which can further compromise oral health, which is a very important determinant of cardiac health. بحكي لك كمان مثلا if you floss every day is more protective than if you exercise every day. Both are important, but this can highlight for you how important it is to have a great oral hygiene. So biofilm formation, fermentation of sugars, and then production of acids is the main mechanisms of the destruction of enamel. And then حكينا they are facultative anaerobes, they ferment and then they remove all the oxygen, and then the anaerobes invade. تذكروا حكينا we mentioned شوي peptide بأول محاضرة, and then these grow under the anaerobics or microaerophilic conditions, and they are still main normal members of the gut, the mouth, and the female genital tract. And then again they participate in mixed anaerobic infections as well. Peptostreptococci and valence group, both members of the oral flora, are often found in brain abscesses following dental surgery. كتير مهمة هاي. This is the second part حكينا. Oral bacteria, the two main pathways that they can cause damage after dental surgery. الأولى حكينا الهارت, الثانية البرين. And then you find them as a part of a mixed anaerobic infection. زي ما حكينا هي الميكانيزم. شو هي الميكانيزم؟ So these facultative anaerobes زي Streptococci, Peptostreptococci will reduce the oxygen, and then anaerobes will flourish, and then this will have you have both of them as a mixed infection together. Transmission, where do they come from? So transmission is usually from the source of colonization. Wherever it is colonizing. So in this, the human throat, the skin, intestine, whatever حكينا موجود مثلا Enterococcus, group A, Viridans group, and then they like to gain access to tissues or blood. Viridans, Streptococci, and Strep pneumo are found chiefly in the oropharynx. Group A Streptococci in the skin and the oropharynx. Group B in the vagina and the colon. Enterococci and Strep bovis and anaerobic Streptococci are also located in the colon. Pathogenesis. Group A حكينا it has the three pathogenesis mechanisms. حكينا this is the dominant one in disease causing, so it has pyogenic inflammation على الpharynx, على skin, exotoxin producing, it can cause toxic shock with this TSST exotoxin, and immunologic حكينا with the M protein antibodies against them, which are the rheumatogenic and the nephrogenic, again which causes immune complexes مهمة that damage normal tissues, which is the cause post-strep disease, which is rheumatic fever or post-strep glomerulonephritis. So that's for group A. وهي التابل الثانية المهمة. So لما نطلع على type of pathogenesis, group A عندها all three: pyogenic, which can be local, skin, pharynx, disseminated, it can cause disseminate in the bloodstream and cause sepsis. How does it cause sepsis? And it is a gram-positive by teichoic acid, and when we break it down, it can cause fever and sepsis the same. تنزل الضغط وكل شيء and can kill the patient. Toxigenic راح نحكي عن تنتين. Scarlet fever mainly attacks the skin, and toxic shock, which can تعمل shock obviously. And then immune mediated هم حكينا post-strep non-suppurative rheumatic fever and acute glomerulonephritis, rheumatic fever, heart and joints, and glomerulonephritis is kidney. Agalactic group B, all of them and from now are pyogenic. So group B حكينا sepsis and meningitis, and it's mainly in the vagina. This is where it sits. E. fecalis in the colon, Strep bovis in the colon, normal flora. حكينا E. fecalis can cause UTI and endocarditis nosocomially as well. هذا كمان Streptococcus bovis in colon cancer. Stretococci راح نحكي عن pneumonia, meningitis. هي أول جروب حكينا بالمننجايتس. راح نجمعهم هدول the ones that cause meningitis. فهي the representative of the gram-positive cocci is Streptococcus pneumonia. راح نحكي عن gram-negative cocci، راح نحكي عن اللي هي meningococcus. بعدين راح نحكي عن gram-negative rods اللي هي hemophilus. gram-positive rods اللي هي listeria. بعدين راح نحكي عن مثلا اللي هم الفنجاي اللي هي راح تكون the main one اللي هي Cryptococcus. So that's the 5 ones. كل واحدة gram positive coccus, gram negative coccus, gram positive rod, gram negative rod, and then fungus. وين كنا؟ تمام. meningitis, Viridans, Streptococci, endocarditis, normal flora in the oropharynx. So it's a cause disease. D colonizes C or normal flora in F. شو ضل؟ M protein حكينا most important antiphagocytic factor، ما في شيء جديد. capsule hyaluronic acid which is antiphagocytic antibodies are not formed against the capsule. It's hard because of the hyaluronic acid. It's a normal component of body, which is a cell protein, obviously. Group A includes important inflammation-related invasion factors, like this is invaders. So they have hyaluronidase, which degrades hyaluronic acid, which helps them with invading tissues. And this is how بحكي لك group A Streptococcus, if it can get under the skin, it can cause rapid invasion, and they can cause مثلا they are flesh eating bacteria. They eat the flesh very quickly. Streptokinase زي staphylokinase, it breaks down fibrin clots, and كانوا قبل التي بي اي قبل الالتيبليز كانوا يستخدموا streptokinase to break down clots, and patients اللي عندهم مثلا heart attack كانوا يعطوهم streptokinase to break down the clot, and this is the medical treatment لها. بس هلا عندنا التيبليز which is far more superior. طبعا الستريبتوكاينيز راح يعمل عندك لانه بما انه it's a bacterial toxin can cause an immune reaction. DNAs, streptodornase degrades DNA, and then you have streptokinase streptokinase mixture applies to the skin, gives a positive reaction in most adults and means that it is normal cell mediated immunity. تمام. So the group A exotoxins الأول هو erythrogenic toxin. This one causes scarlet fever. بسموها erythema marginatum. This is an action similar to that of TSST اللي موجودة بالستاف aureus اللي هو also acts as a super antigen. It is produced only by certain strains of strep pyogenes lysogenized by bacteriophage. حكينا lysogeny of bacteria by phages is the most common mechanism of exotoxin gene dissemination. So if you are a group A infected by this phage, you might carry the gene for the toxin, erythrogenic toxin. The injection of a skin test can give a positive result in people that don't have the antitoxin. So this is scarlet fever. This is what it looks like. راح تلاقيها انها كتير صعبة تفرقها. مثلا كawasaki ممكن تفرقها مثلا ريدمان syndrome، تفرقها عن مثلا diffuse rash for ستيفن جونسون مثلا. بس يعني the course of the disease مثلا معاه pharyngitis بعدين صار معاه هاي, so it's most like it might help you with the a little bit making your decision. بعدين عندك investigations to يعني انك to own in on your diagnosis. Streptolysin O حكينا this is the hemolysin that breaks down RBCs, and this is why they have beta hemolysis. And antibody شو مهمة streptolysin O؟ إذا بدك واحد عنده روماتيك فيفر أو عنده سكارلت فيفر أو عنده post-strep glomerulonephritis and it happened already صح. So he had the infection, he cleared the infection, the antibody titer was high, and the antibodies over time is destroying the heart, destroying the kidney, destroying whatever, and then he had rheumatic fever or he had post-strep glomerulonephritis. You want to prove that he had the infection because now by this time he had cleared the infection. So you can look for antibodies for streptolysin O اللي هو موجودة بالجروب A streptococci, and that can tell you إنه he had the infection previously with group A strep. So this is a common lab investigation in these instances. Streptolysin S is not inactivated by oxygen and is not antigenic, so we don't use it for diagnosis. Pyrogenic exotoxin A اللي هو تبع يعني this is the streptococcal variant of the TSST زي تبع staff. It's still a super antigen, and if the patient happens to be infected by a strain that produces this exotoxin, they will have anaphylactic shock. So this is in a very similar manner as the story حكيناها بالستافيلوكوكساي. Exotoxin B is a protease. It breaks down proteins, and this is produced in the strains that happen to cause flesh-eating bacteria, Streptococci, that invade and then happen to have exotoxin B. They break down uh, proteins of tissue very quickly, and they can cause necrotizing fasciitis, necrosis, and destruction of red blood vessels, tissues, all forms of proteins, and then can cause a very rapid and can be fatal reaction called necrotizing fasciitis. This is بالفصل القادم نزيد عليها شوية. So this is necrotizing fasciitis. So pathogenesis by group B streptococci اللي هو هنا streptococcus by inflammatory reaction by direct pyogenesis. So meningitis, sepsis in the newborn. So there's no enzymes or immunologic induced disease. Group B have a polysaccharide capsule which makes them antiphagocytic. Pathogenesis by strep pneumonia and this group is uncertain as they don't have any exotoxins or immunologic reaction as well. Many of the strains of main various factors of strep pneumo is also antiphagocytic capsule. Many of the strains of virulence group that cause endocarditis produce a glycocalyx حكيناها. So virulence group is the biofilm formers. So this production of biofilm, this glycocalyx, enables them to stick to the heart and cause destruction of usually already susceptible heart valves. هاي راح تشوفوها مهمة later on in tests. خاصة مثلا US اللي بيحبوا مثلا يحكوا native valves اللي ما عليهم أي مشكلة, they are usually susceptible to staph, whereas valves that have a problem they are more susceptible to strep. pneumococcus capsule عندها مشكلة هاي اللي منشون. group A عنده exotoxins and invasive enzymes, and group B inflammatory and cause neonatal sepsis. Clinical findings. What else that we have not mentioned so far? Pyogenic disease. Okay, we mentioned this. Toxogenic scarlet fever, TSST, immunologic حكيناها. So for pharyngitis, what do you see? On examination, you will see an inflamed throat, inflamed tonsils, yellowish exudate, هذا هو pus being formed, as opposed to a مثلا viral ما راح تلاقي yellowish exudate. مثلا tender lymph nodes around مثلا cervical lymph nodes عادة أكثر شيء, أو around the شوفوا الأناتومي مهمة, شوفوا مثلا around the course of the jugular, under the jaw مثلا. So if you leave it untreated, it can cause rheumatic fever if it happens to be an M protein that is rheumatogenic. Untreated pharyngitis can also extend to otitis media, sinuses, mastoid, meningitis, difficult to swallow because they can cause tonsillar abscess as well. شو طلعوا هون مثلا this is the exudate that you can see in bacterial tonsillitis مثلا, and this is viral, ما فيش شيء exudates, ما في pus, it's very hyperemic, very red, whereas this is مثلا it's less red but it's mostly we can see this pus being formed. Scarlet fever develops in patients who are infected with the erythrogenic toxin producing group A. The strawberry tongue, which is again حكينا موجود بالكawasaki, موجود in other diseases. Strep pyogenes also causes another toxin mediated disease هو toxic shock, which is the shock will be low blood pressure and مثلا هذا أهم وحدة. Different from staph toxic shock, they usually have إذا بتذكروا كنا نحكي عن staph, in staph عادة you don't find blood cultures positive if they have toxic shock from staph, because عادة لما حكينا مثلا nasal packing or مثلا tampons or wound, بالstrep لا عادة we find blood cultures positive because usually they will cause streptococci that cause toxic shock are typically present in the blood بعكس staph. جروب A ستريبتوكوكسايكوز ما في تمام حكينا هاي امبيتايجو تمام ليمفانجايتس تمام اوكي. إريسيبيلس بنحكي عن ريتس ليمفانجايتس بنحكي عنها الفصل القادم but this is just to look at them to see what they look like. There's a skin infection group A streptococci. Group A can cause endometritis تمام. Group B on the other hand causes neonatal sepsis and meningitis. And then women who are colonized and have had premature rupture of membrane, so the membrane and the baby is being susceptible to the flora. Now the flora is able to go through the membrane. If they are colonized with group B, they are, and then they have delayed birth, يعني بطولوا, so there's more time for the bacteria to go through this ruptured membranes and then cause sepsis and infection in the children. The premature children or mothers who have had no antibodies to group B are greatly at risk of group B disease. تمام. I think this will be the afwan. تمام. This is where you would want to stop if you want to take a break. This will be the first lecture. Now we're going to go through the second lecture for Streptococci. So although group B infections are commonly seen in neonates, group B Streptococci are still able to cause infections in the adults. They can still cause pneumonia, endocarditis, arthritis, cellulitis, osteomyelitis, but they are really rarely seen in that case. Postpartum endometritis. So this is endometritis, so endometrium, infection of the endometrium. So this is the infection of the lining of the uterus. Postpartum, yani after birth. So why after birth? So this is basically you have this protected sterile environment of the uterus, which has been now invaded by the non-sterile environment of the vagina. The baby has went through. So كل هاي الطريقة مفتوحة. The cervix is maximally dilated. If the patient or if the mother happens to be مثلا colonized, so these bugs can ascend and cause endometritis. ضيف على هذا there's a lot of instrumentation that happens during birth. مثلا بيستخدموا clamps, ممكن يستخدموا these scissors, ممكن يستخدموا مثلا الطبيب نفسه دائما مثلا كل ما يجي they want to بتشوفوه لما تداوموا إن شاء الله. You always have to insert مثلا an instrument or maybe your hand so you can test the dilation of the cervix. كل هذا you're introducing bacteria. If there happens to be premature rupture of the membrane or whatever, you're still introducing bacteria to the more sterile environment of the uterus. Diabetes هاي هي كتير مهمة وراح تشوفوها بكل إشي. Diabetes is a main predisposing factor for all infections. But diabetes is a main predisposing factor for adult group B. طبعا obviously فكروا فيها زي كأنه makes the uncommon makes it common. Why do people with diabetes? There's lots of things that can say. في ناس بيحكي لك مثلا the blood sugar الموجود عادة الزيادة هذا is usually glucose which is easily utilized by the bacteria. في ناس بيحكي لك this is not as simple as this. Bacteria مش simple as glucose is يعني إنه diabetes has over time this accumulation of sugar products can cause less blood flow, less recruitment of white blood cells, dysfunction of the immune system, dysfunction of the nerves. كل هذا بيجي as a syndrome مع بعض which can predispose to all sorts of infections. So virulence streptococci are the most common cause of infective endocarditis. They typically enter the bloodstream. bacteremia after dental surgery. تمام. شو الساينز؟ شو بنشوف؟ fever. تمام. يعني endocarditis. شو القصة؟ شو راح تشوف هالقصة؟ مثلا patient عمل عملية بعد كم من يوم من العملية صار عنده fever. Now we have a new heart murmur. تسمع الهارت، تسمع murmur جديدة. عادة you see مثلا a regurgitant valve, and then you have anemia. Embolic events راح تشوف مثلا problems on their hands and feet of these emboli that come from the heart, and they cause a blockage of مثلا certain areas in the skin. عادة أكثر شيء بالhands and feet, and they can cause symptoms as splinter hemorrhages بالnails and petechial hemorrhages مثلا بالsubconjunctiva. بورجيكم هلا كمان Janeway lesions. All these are things that are signs and symptoms of endocarditis. The vegetation of the heart valve is 100% fatal unless effectively treated with antimicrobial agents. So if you don't treat it, it will destroy the valve over time and then cause complete destruction of the valve, which is obviously incompatible with life. About 10% of endocarditis cases are caused by enterococci. 90% مش enterococci، هذول حكيناهم. And then the bacteria may have already deformed valves. To diagnose endocarditis, you have to have 3 positive blood culture. تعمل blood culture مختلفين عن بعض, and then you find the organism is recovered in most of the cases. هاي مثلا طلع عليهم, so you can see these Janeway lesions زي هيك بيكونوا on the hand. These petechial hemorrhages on the hand. This is splinter hemorrhages on the nail. Viridins streptococci are especially مثلا اللي هم all these groups are زي حكينا important cause of brain abscess, and then this is usually mouth anaerobes, mix anaerobes with aerobes of the mouth. So dental surgery, if you do dental surgery, if you have a patient with dental surgery, so this is an important predisposing factor for brain abscess. So if you are a dentist, you have to have access to the brain and the heart from bugs in the mouth, so be very careful. Dental surgery provides a portal for the viridins and the anaerobes of the mouth to enter the bloodstream and then cause these infections. Group D. So we have these 2 group Ds. حكينا the enterococci. So حكينا هذول are hospital acquired infections عادة because they are normal flora. So أكثر شيء بيعملوا catheters. ليش catheter؟ المريض بالهوسبيتال، المريض ما بروح على الحمام، المريض أو بروح على الحمام عادة you put a catheter, a urinary catheter عنده، فأنت بتفتح قاعد you are inserting something and you're opening the pathway to the sterile bladder. وهذا البيشنت بهالهوسبيتال بروح على الحمام, you have a catheter in there, بالكاثيتر يتغير يوميا أو whatever. So كل هذا manipulation will introduce these bacteria into the sterile bladder and cause infection. So because they are in the gut, that's why they gain access to the urinary tract. فإن urinary UTI in the setting of hospital, الbugs مختلفين عن UTI in the setting of the community. So enterococci are also cause of endocarditis. حكينا in patients who have undergone GI or urinary tract surgery or instrumentation. So why do we not say endocarditis are active enterococci? Because we do a lot more dental surgeries, obviously, than GI or urinary tract surgery. They also cause intra-abdominal and pelvic infections, typically in combination with anaerobes. So patients with highest typical حكينا مع carcinoma of the colon is so strong, this association, that if you find endocarditis طلعت strep bulbus, you definitely have يعني it's very 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 likely that they have colon cancer. Non-suppurative diseases by Stretococci. So these are the local infections. مثلا group A Streptococcus followed by weeks. So post-Streptococcal non-suppurative diseases. So it takes that much time for enough cross-reacting antibodies to be produced against the M protein. So حكينا بعض strains are nephrogenic, other strains are rheumatogenic, and the most strains are neither of these 2. شو acute glomerulonephritis شو بكون شكلها كيف how do you see it? So typically this occurs حكينا weeks after عادة most likely skin infection. هلا شوفوا كيف الكتب أغلبها بتحكي إنه skin infections M protein that predirect to skin infection are more likely glomerulonephritis. والM proteins that predirect to the pharynx بيعملوا rheumatic fever. بس لما شفت اسئله مثلا شو اسئله البورد الامريكي والبورد البريطاني وهدول this distinction is not really ما بعمل هاي distinction كتير. But just keep it in mind that following skin or pharyngeal infection, more likely skin infection that will cause glomerulonephritis. طفل كان يلعب، شو القصة؟ طفل كان يلعب جرح حاله، صار عنده سيلولايتس، ما أخذ أنتيبايوتيك، سيلولايتس طولت شوية، بعدين it resolved. or ممكن يحكوا لك إنه pharynx which is less likely. صار معه pharyngeal infection و was not treated، بعدين صار في عنده هاي السيمبتومز. شو الهم symptoms؟ hypertension. This is very almost always odd in a child. ما في child معه ضغط إلا there has to be secondary، ما راح تكون primary ضغط زي الادلتس. edema. why edema؟ you know if you are losing protein, obviously then the oncotic pressure will change, and then you will have fluid leaving the capillaries and going to the tissue. So we'll have edema of the face, periorbital edema, and the ankles as well. Smoky urine. شو smoky urine? So you have RBCs and proteins can be in the urine. So if you see plus RBC plus white blood cells، مش white blood cells plus RBCs، ممكن plus white blood cells, and most likely the protein, the loss of protein is important. الحلو الحمد لله كويس بالacute glomerulonephritis post strep glomerulonephritis is most patients recover completely. However, they are still prone to develop this again. مش إنه صارت معه خلاص ما تصير معه. If they have strep infection again, they might have, and it happens to be M protein, they will make the antibody titer أعلى, and then they attack their kidney again, which can happen again and again. هلا رح نشوف لقدام شوي لما تاخذوا urinary tract إنه والكدنيز إنه في شيء اسمه nephrotic syndrome، شيء اسمه nephritic syndrome. And nephrotic syndrome has more protein loss. Usually post-strep glomerulonephritis is part of the nephritic syndrome, but it can reach nephrotic range of protein loss. Acute rheumatic fever. تمام. Acute rheumatic fever شو حكينا عن endocarditis presentation. هلا presentation of rheumatic fever is different. Again, this is weeks after an infection, usually pharyngitis. شو بصير معه؟ fever. Migratory polyarthritis مهمة. So joint pain, fever, carditis. So inflammation of the heart muscle, ممكن يكون damage to the heart muscle, valves, new murmurs, palpitations, whatever. Okay. 4. Uncontrollable spasmodic movements of the limb chorea. So you will have fever, joints, heart, dancing. So which is spasmodic movement of the limbs of the face, chorea. كل هدول مع بعض. You have this, and then you want to make sure that this is rheumatic fever. You do the ASO titer. You find that it is elevated, and the ESR is also elevated. معناتها هذا most likely acute rheumatic fever. هلا الجروب A streptococcal skin infection do not cause rheumatic fever. هذا اللي حكيت لك قبل شوية. So this is most likely true, but the distinction is not that important maybe. رقم 5 erythema marginatum. So مع بعض there's a lot of mnemonics. So this mnemonic لما يحكوا عن rheumatic fever they call them the Jones criteria. Jones with the J. So Jones, J joints, O heart, so carditis, N هم النوديولز subcutaneous nodules, E erythema marginatum, and S اللي هي الكورية Sydenham كورية بسموها. So this is one way so you can memorize this. Similar post-strep glomerulonephritis. If you have it once, you still can have it. So you have to make sure that the patient does not get pharyngitis, and he does not get untreated pharyngitis, so it does not cause further damage to their heart valves. Again, this is immunologic reaction between cross-reacting antibodies to certain M proteins. Again, it is an autoimmune disease greatly exacerbated by recurrence. يعني كل ما تعمله مرة ثانية ثالث كل ما get infected second and third time cause more and more damage. عادة بيحكوا لك if you treat infections of streptococci within 8 days this will prevent rheumatic fever. فمعك 8 أيام. So هلا بتشوفوا البيدياتريكس كتير بيحبوا مثلا to wait before giving antibiotics. Give the patient لأنه مش بكل بكتيريا راح تكون جروب A ولا كل جروب A راح تكون ام بروتين تبعها شو اسمه rheumatogenic. بس again we do not want to exceed the 8 days. It's important enough not to leave any untreated. You give him 2-3 days in البداية to get over the infection by themselves. عادة راح يكون viral and they will get over it. if فراح تشوف كتير البيدياتريكس شو بيحكوا إذا ما مشي الحال عادة بيعطوهم another prescription. إذا ما مشي الحال زادت الفيفر ما راحت الفيفر طولت الفيفر طولت السيمتومز أبصر شو بكتب لك prescription تاني مثلا أموكلان أو whatever بيحكي لك خذ هالبنسلين. إذا ما مشي الحال بعد يومين بلش البنسلين treatment. This is a very common way how pediatricians react to this way to prevent rheumatic fever. So you find that مثلا بأسئلة البورد بصير يحكوا له مثلا واحد إجا من منطقة معينة من دولة معينة ما فيها antibiotic treatment أو antibiotic treatment is not there أو whatever country يعني. فعادة بيحبوا مثلا إنه يحكوا مثلا this is a country where healthcare is lacking and children can go undetected and they can have a fever for a long time and then they get over it by themselves, so that they're more prone to having rheumatic fever. If someone has rheumatic fever, they must be prevented by long-term prophylaxis again. So in the US بتشوف مثلا very few cases of rheumatic fever, but in the developing countries زي ما حكيت لكم is about 5%, so about 10 times. Lab diagnosis, you want to diagnose these. So gram stain هنا مثلا useless. ليش؟ in pharyngitis because this is normal flow راح تلاقي كتير streptococci هناك. But مثلا smears from the skin lesions or wounds reveal streptococci is diagnostic. You know, this is an overgrowth. Cultures of swabs from the pharynx or lesions from the blood agar plates show small translucent beta hemolytic colonies هنا مثلا within after the first day عادة. So obviously inhibited by basic tracing كل اللي حكيناه بالبداية. Group B characterized by their ability to hydrolyze hippurate وجدتكم صورته. So this is one way you can diagnose quickly. So you can have enhanced hemolysis on the blood agar when combined with beta hemolysis of the Staph aureus. This is called the CAMP test. تحطها مع ال Staph aureus, it will improve its hemolysis. Group D, bile osculin, who is a very important one, produce black colonies on the bile osculin agar, and this is a very quick method to detect it after growing it on this agar. هاي نرجع هاي لك تطلع عليها مرة ثانية. هاي حكينا of the diagnosis. And this is all what we just mentioned: the hippurate, the basic tracing test, and all that. Bile osculin هاي شكله. This is the bile osculin agar, and this is the black colonies of Enterococcus on bile osculin agar. Although cultures remain the gold standard for diagnosis of streptococcal pharyngitis, problem exists اللي هي culturing is not available عادة for at least 18 hours. يعني الريزلت ما بيرجع لك إلا at least 18 hours. يعني هذا إذا أنت صحب كتير مع الميكروبيولوجيست وبقعد لك قاعدة على البنش يطلع لك إياه. But this is usually 2 to 3 days قبل ما تجيك النتيجة. So that's why sometimes you can't wait. And this is where you want to have a rapid test. You know, so this is the throat swab مثلا زي ما جلستكم إياها. So the rapid test detects the bacterial antigen in a specimen by specific antigen antibody reaction. An agglutination of colored latex particle for group A present مثلا throat swab. The specificity is high. إذا كان positive بطلع هو positive, but sensitivity is low. So there's a lot of false negatives that can happen. فهي شكل الرابid test بيشبه البريجنسي test. So you have to have a control. الكنترول لازم يكون موجود. إذا الكنترول شغال معناته التست شغال. إذا ما فيش كنترول التست مش شغال بتكبه حتى لو طلع لك بوزيتيف. الكنترول شغال بعدين بتطلع في ترو في بوزيتيف خلاص بوزيتيف. mild برضه positive فيش ولا إشي negative. So that's usually how rapid tests work حتى لو يعني including the group A strip test. Rapid test is also available for detection of group B كمان in vagina and rectal samples, and this can give you a result within 1 hour. This can give you the decision: should I treat the mother before ولا لا؟ أعطيها penicillin ولا لا؟ Is she colonized ولا لا؟ Venous group Streptococci حكينا resistant to lysis by bile, and then they are resistant to optogen. Serology, ASO titers are very important for post group A. Bacteria is usually cleared by the time هذا اللي حكيناها. So you have this gives you previous anti-DNase B is also high in group A skin infections. So this can give إذا تستخدم ASO أكتر للروماتيك فيفر ممكن تستخدم anti-DNase B for previous skin infections for people with post-strep glomerulonephritis. Treatment شو treatment؟ خلينا نحكي group A are usually treated with simple penicillins. هذا يعني the dominant disease causing one is a simple penicillin, and then you are خلاص you have solved your problem. So even penicillin G can work. عادة أموكلان نعطيهم amoxicillin is the mostly given here. It's as mentioned, this is not protective for antibody mediated illness. But these patients do not benefit from penicillin treatment after the onset of the disease. شو هذا بحكي لك يعني إذا صار مع antibodies already and then he has a rheumatic fever, إذا تعطيه penicillin at that time it'll be useless because now he has cleared the infection and the antibodies are causing the disease. In mild group A, oral penicillin is finished is done. Penicillin allergic patient تعطيه مثلا clarithromycin, azithromycin مثلا عادة. Clindamycin can also be given to penicillin allergic patients. Usually group A usually is not resistant to penicillins. Endocarditis بدها prolonged penicillin treatment. This is important. بدها بتطول treatment تبعها because you have to reach all the small nooks and crannies of the heart and clear the bacteria inside. enterococcal endocarditis تذكر هذه هاي الأورجانيزم اللي هي enterococcus كانت هي الزعيمة بالانتيبيوتيك ريزيستنس بالستريبتوكوكساي. So penicillin will not work. عادة vancomycin تعطيها. هذا مهم كتير تيجي بالأسئلة. Vancomycin, what do you give? You give vancomycin and combine with the aminoglycoside بكون أحسن وأحسن. So you can clear the endocarditis of enterococcus. Usually resistant to many drugs, so resistance كتير عالية. So هلا صار عندنا vancomycin resistant organisms, فبتعطيه vancomycin مع الأمانجليكوسايد لسه كمان مش ماشي الحال. So we have two drugs that can treat these VRE infection, linezolid and daptomycin. Usually these are your last line of what you can have, which you can use. بالنسبة للنون جروب دي الستريب بوفيس they're not highly resistant and can be treated with penicillin G and ampicillin مثلا. This is good to this is a good news here. Prevention. What do we do? Do we have any preventative measures? So obviously اللي هو prompt antibiotic treatment for group A strep pharyngitis to prevent rheumatic fever is very important. People who have susceptibility and then have had previous strep infections لازم ينعطوا usually مثلا penicillin once a month for a few years. There's no evidence that patients who have had glomerulonephritis require this. So patients with damaged heart valves who undergo invasive dental surgery هاي مهمة. If you are a dentist and you are doing heart surgery you're doing dental surgery with a patient who already is reported to have damaged heart valves, فأنت عندك يعني this is a very high chance of causing يعني بصير مثلا إذا كان عنده normal heart valve بدك مثلا 10,000 بكتيريا يدخلوا عشان يعملوا disease. If he has a damaged heart valve بس 10 مثلا ممكن يعملوا disease. So this is very important to pre-operatively تعطيه amoxicillin pre-operatively. This is very important. Pre-operatively they load them and then they do the surgery. So عادة بيحكي له تعال خذ هالدواء يوم أو يومين ضلك خذ لك كم حبة بعدين تعال he is loaded with the amoxicillin بعدين بيعمل له surgery and then continue the antibiotic after the surgery. So it's recommended to give amoxicillin prophylaxis only to those patients مش لكل واحد بيعمل له dental surgery يعني مثل patient with prosthetic heart valves or previous endocarditis. الجروب B شو بيعملوا؟ الجروب B prevention to reduce the incidence of neonatal sepsis and neonatal meningitis. We screen all pregnant women. كل ال pregnant women كنا might be able to screen them. هذا باليو كي كنا نشوفه كان يعمل they did the screen in some hospitals, some trusts they did this actually. So they screen all pregnant women at 35. تعمل له culture rapid test ممكن تعمل إذا positive تعطيها penicillin G or ampicillin and then you clear you decolonize her and then she has the baby she's fine. If the patient has not had cultures done وهذا راح تشوفه this is the common cause this is the common scenario يعني إنه عندك patient ما عنده culture ولا عامل test فممكن تعطي penicillin just at the time of delivery for women who experience prolonged rupture of membrane. هاي هي الكلينشر هنا. مش كل ما نعطي كل الwomen that are delivering penicillin. So if she has premature rupture of membrane and she has prolonged rupture of membrane طولت then نعطيها penicillin just to cover our tracks and so we don't have to prevent neonatal sepsis and meningitis. Or an ampicillin given to these women who are vaginal carriers does not eradicate the organism. بحكي لك as you decline group B infection you are increasing those by E. coli. This is a funny here thing. So you cover tracks on one bit another one comes up. There are no vaccines available to any of these except Streptococcus pneumonia. راح تشوفوا كل الحمد لله كل البكتيريا that causes pneumonia إلها هو مطعوم السحايا meningitis vaccines. هلا ندخل على Streptococcus pneumonia لحالها diseases it can cause them very common diseases and very can be serious. من اسمها pneumonia أول واحد pneumonia ثاني إشي بكتيريا ممكن تعمل بكتيريميا and sepsis ثالث إشي meningitis بتخوف and the most common that you will see is upper respiratory tract infections otitis media, mastoiditis, sinusitis. They are the most common cause of community acquired pneumonia. Important. One of the dominant causes of meningitis as well. إذا بتجمع كل age groups but maybe حتى pneumococcus is the commonest. Sepsis in splenectomized individuals نحكي عنه. Any patients that loses their spleen they become prone to infections by capsulated bacteria. حكينا كل البكتيريا that causes meningitis are capsulated bacteria بينهم Streptococcus pneumonia. So they are an endangered group of patients here. So these patients will لازم نعطوا مطعوم سحايا to cover your tracks if they are splenectomized ومثلا عنده sickle cell anemia وصار عنده autosplenectomy he still has to be given this vaccine. Otitis media, sinusitis كمان. They are common causes of conjunctivitis. تمام. Important properties pneumococci gram positive lancet shaped diplococci they do not grow in chains they grow 2 by 2 and then lancet shaped ايش lancet يعني زي هيك شفرة من هون وشفرة من هون هيك so هلا بورجيكم صورة اتوقع عندي صورة so have the oval pointed ends rather than being round. On blood agar they produce alpha hemolysis and they are lysed by bile بعكس الفيريدنس and they are sensitive obviously to oxygen. هاي شكلهم هاي this is the lancet shaped diplococci وهذا الكليرنج الابيض اللي حواليهم this is the capsule ما بتشوفه انت بس بتشوف انه عادة كثير مثلا lipids او lipopolysaccharide لما تحمل له H&E ببين clear. So here you have peridens represented by strep mitis and then strep pneumonia. بتحط له optogen test وهاي both are causing alpha hemolysis, and then this one is cleared by the optogen. Pneumococci possess polysaccharide capsule. هذا حكيناهم. Clinical patient, there are 85 antigenically distinct types of this capsule. Specific antibodies to the capsule opsonize the organism, obviously, and facilitate phagocytosis. So, capsular polysaccharide elicit primarily B cell or T cell independent response, as you recall. Another important surface component of strep pneumonia is teicoic acid, which is in the cell wall called the C substance, also called C polysaccharide. إذا تسمع بالacute phase proteins كنا بنحكي عن CRP, C reactive protein. C reactive protein is a protein that reacts to this C polysaccharide in the Streptococcus pneumonia. So that's why we call it C reactive protein. It's a very important acute phase protein وهو بنستخدمه كتير to see if the patient is in an inflammatory condition. So it's a non-specific indicator for inflammation, as elevated in response of many organisms or many inflammatory conditions كمان, not just Streptococcus pneumonia. مهم كتير, not just strep pneumonia. Almost all infections and lots of inflammatory conditions have high CRP. This is where the clinical importance of C substance comes. This is measured. وراح تشوف CRP is one of the most common blood tests that you do if you want to see if there's an infection or inflammation. حتى مثلا ناس people who is a predictor for heart attack if they have high CRP with an elevated أكثر من elevated cholesterol level. CRP, high CRP is important. Transmission, شو transmission بيناتهم؟ عادة humans are the hosts and they transmit to each other, especially pneumococci. A proportion up to 50% of healthy people, they have virulent organism in the oropharynx. Pneumococci infections are considered non to be communicable, so it's a communicable disease. It happens from your own flora. Resistance is high in healthy young people, which is good, and disease results most often predisposing factor are present. تمام. Pathogenesis, virulence factors. So most important virulence factor is the capsule. Lipoic acid, a complement activator, can cause cytokine response, it can cause septic shock. So it's not an exotoxin, this is أقرب للإندوتوxin. So زي ما حكينا, it's present is يعني similar to the LPS in the gram negative. Pneumolysin is the hemolysin that causes alpha hemolysis and it contributes to pathogenesis, and they produce IgA protease. هاي مهمة. كل encapsulated bacteria that can cause colonization of the throat and cause meningitis will have IgA protease. ليش? They have to break down the IgA that you coat your mucous membranes with to prevent attachment. If they break down the IgA, then they can attach to the mucous membrane. If they can attach to the mucous membrane, if they happen to invade the blood, then they have the capsule. The capsule شو بيسويهم؟ بيبعدهم عن الphagocytosis. So they can just travel this short distance from the pharynx to the brain, and then they cause meningitis. That's the story of meningitis. So you have IgA protease plus capsule equals meningitis. So IgA protease enhances the organism's ability to colonize the mucosa of the upper respiratory tract. So all the meningitis causing capsulated organisms will have IgA protease. Factors that lower resistance and predispose persons to pneumococcal infections. Anything that depresses the cough reflex. مثلا واحد who is intoxicated, who is sleeping intoxicated or whatever, they don't have cough reflex, they can aspirate and they can have pneumonia of their own flora, which عادة راح تكون pneumococcus. Abnormality of the respiratory tract مثلا pooling of mucus, obstruction, respiratory tract injury by an irritant. All of these will predispose to a community acquired pneumonia of your own bacteria, which is pneumococcus. Abnormal circulation مثلا, if you have congestion, heart failure مثلا, left heart failure will cause congestion in the lung. This congestion in the lung will cause increased pulmonary secretion and the pneumococcus might grow. حكينا كمان آخر واحدة هي splenectomy because of the capsulated organism. So anybody who doesn't have a spleen, sickle cell anemia, مثلا autosplenectomy, or مثلا patients who have had a traffic accident and lost their spleen, whatever, they are also predisposed to pneumococcus. Anything that can trauma to the head that can cause leakage of the fluid. مثلا واحد صار مع قاعد بتشوفوه مثلا بتذكرها هاي كان بحبوها بالاسئله كان in the lab. صار معه road traffic accident وطلع clear fluid from his nose. What is he susceptible to? Meningitis. Why? Because this spinal fluid has went through the cribriform plate and then broke the meninges, and then the CSF, who is clear fluid, the CSF is coming out of his nose. So now there is clear communication between the non-sterile pharynx اللي هو معبى كله bacteria, pneumococcus, whatever, and then the cribriform plate, and then for meninges, and this can cause meningitis. Clinical findings: pneumonia, sudden chill, fever, cough, and pleuritic chest pain. This is what you get from pneumonia. So chill إيش يعني؟ بتصير this is a reaction to bacteria in the blood. Fever, high fever, cough, pleuritic pain that increases with chest movement and breathing. Sputum can be red or rusty color. Bacteremia طلع كتير up to 25%. كتير مهم بتخوف هاي انت عملت sepsis عند patients. Spontaneous recovery begin from 5 to 10 days, and obviously you have the antibodies formed at that point. Pneumococci are a prominent cause of all the otitis media, mastocytitis, conjunctivitis, bronchitis, pericarditis, meningitis, and sepsis, and is the leading cause of sepsis in patients without a functioning spleen. Lab diagnosis: what do we do to diagnose them? Okay, so lab diagnosis in the sputum. If you get sputum and you do a gram stain, you will see these diplococci, lancet shaped diplococci. تذكروا حكينا عن curling reaction, which is using an antibody against the capsule, and if you put the antibody in the capsule will swell, and you can detect this in multiple antiserum. Blood agar, they will cause small alpha hemolytic colonies. Bile soluble, inhibited by apoptosis. Okay. Blood cultures are positive in many of these infections زي ما حكينا. هذا نفس الرقم اللي هو السبس اللي هو بكتيريميا. Culture of CSF is usually positive in meningitis. Rapid diagnosis for this إذا بدك تعملها ممكن تعمل يعني صعب، ممكن ما يتطلع، ممكن تعمل جرام ستين على CSF على طول، ممكن يبين معك. If you see any bacteria in this case خلاص هاي diagnostic. But أنت بتخاف من contamination, so you still do a culture. It's capsulated polysaccharide in spinal fluid using the latex test. ممكن تعمل latex test عليه وتشوف إنه وجود الأنتيجين. The same is also available for pneumonia as well. Urinary antigen for the C polysaccharide can also be used. Treatment شو تستخدم؟ الحمد لله, like many of the streptococci apart from enterococci, it's still susceptible to penicillin, فبتقدر تعطي penicillin, erythromycin, even though هون resistance يعني بلشت تطلع. So we don't usually use مثلا penicillin. ممكن نستخدم مثلا amoxicillin, ممكن نستخدم penicillin G, that's fine. Fluoroquinolones with good anti-pneumococcal activity, مثلا levofloxacin can be used, especially in allergic patients, or erythromycin. Your macrolide can also be used. Increasing percentage of isolates depend on the location of show high level of resistance, which is here. They do not produce beta-lactamase, so you can use vancomycin for severely ill patients, especially those with they have resistant strains or مثلا sepsis. راح تشوفوا in your practice ceftriaxone, third generation cephalosporin is one of the most روسفين إنه اسمه عنا, one of the most used drugs to cover serious infections by مثلا خاصة المننجايتس تستخدم سيفترايكسون. treatment and prophylaxis بيستخدموه، يستخدم كمان for other life-threatening infections by these severely ill patients. Okay, prevention. Despite the efficacy of antimicrobial drug treatment, the mortality rate is very high, especially in those who are immunocompromised. Splenectomized patients are deemed to be immunocompromised. Patients, in this case, patients and children under the age of 5 should be immunized. هم راح بينعطوا الفاكسين. هم بهذا كل النيوموكوكساي، كل عفوا السيرتوكوكساي اللي بيعمل انتحاب صحايا meningitis, they have the vaccine. All of them, the vaccine against the capsule. All of them is anti-capsular polysaccharide antibodies are formed. So the 13-valent pneumococcal conjugate vaccine, Prevnar 13, is used. The immunogenesis vaccine is polysaccharide to the 13 most prevalent serotypes of the carrier proteins. The 23 one should be given to healthy individuals also above the age of 50. These vaccines are safe and effective, provide long-lasting few years of protection. تمام. Booster dose لمين؟ asthenic patients or people who are very old who might be susceptible to pneumonia from this organism. People who are مثلا asthenic, who has HIV, cancer chemotherapy, تعطيهم هذا عشان to protect them from pneumococcal infections. So من المشاكل اللي بتصير إنه إذا بضلنا نعطي مثلا هدول السترينز 13 وإحنا we cover them, بصير الناس كلهم immune لهم. This can cause the emergence of the other strains as important as causative infections. So زي ما حكينا بالبكتيريولوجي بشكل عام أو بالميكروبيولوجي, if you suppress something you get something else coming up somewhere else. ولهنا بنوقف. يعطيكم العافية. I hope this has been a good lecture. Please send me any questions that you like on Teams or by email. We can do always welcome to do a weekly meeting for questions and answers. ويعطيكم العافية.